joined this morning by a local dentist, Dr. Emery from Aspen Ridge Dental. Thanks so much for coming in this morning.
Thanks for having me.
All right, so we're getting back to basics today. Some of the things that people should know about brushing. Hopefully everyone does, but let's be honest, some people just aren't taught the right things from when they're little. So let's pretend that we're speaking to potential children of a dentist out there, the ideal situation. What are the correct habits, things that people should be doing to take care of their teeth properly every day?
Well, you know, the typical brushing, flossing is what is very, very standard. You want to brush your teeth at least twice a day and floss once a day, typically after every meal, because after a meal, plaque can build up on your teeth, and it's a sticky substance which has bacteria in it. Bacteria secrete acids. The acids then attack the enamel in the teeth, which weaken it. And therefore, it can cause some tooth decay. And so what you want to do is mechanically remove that plaque after every meal so that you don't get those continuous attacks from the acid.
Now, sometimes we see commercials for gum saying that it can help if you chew it right after a meal. Is there any truth to that?
Yeah, definitely. And the reason for that is that the chewing, when you chew gum, you can increase the salivary flow in your mouth, and saliva helps to clean the teeth as well.
Okay, good to know. So we've talked about this a little bit, but get into it a little bit more. I was amazed to find out my wife is adamant about flossing, always preaches the importance of flossing, and told me that it can actually end up adding years to your life. Tell us a little bit about that.
I think so, and the reason for that is when you floss, you're actually removing that plaque in between your teeth. And what happens is if the plaque is left on the teeth for a certain amount of time, it can form tartar or calculus. And that calculus can get hard, and that's what irritates the gums, which can cause bleeding and tenderness of the gums. Once that happens, sometimes the gums will pull away from the teeth, and then it creates pocketing where there becomes more tartar and pus in those pockets. And if there's a lot of that going on, then the bone is going to be destroyed around the teeth, which creates mobility and tooth loss. And in fact, in adults, that's the #1 cause of tooth loss is gum disease or periodontal disease associated with the tartar.
Right. Now, when I was a kid, it was a really big deal to go to the dentist. You dreaded it. There was all kinds of painful tools there. It was like a torture chamber. Nowadays, it seems like things have gotten much simpler. When young kids come in, young patients, are they as afraid of the dentist as maybe older generations used to be?
Not usually anymore. The techniques that we use nowadays are a lot more comfortable for removing the plaque and the calculus underneath the gums, whereas in the olden days, it used to be a lot more abrasive. Get in, get done, get out. But nowadays, it's a lot more comfortable for the patient.
Absolutely. So quick question for you. What are some of the worst foods that you can be eating that can be damaging to your teeth or that might stain your teeth? What are some things people should maybe try to avoid eating too much of?
I think sweets and sticky sweets, especially gummy bears, Jolly Ranchers, anything like that that can get stuck in between your teeth. Even potato chips, for example, or the refined carbohydrates like bread that can get stuck in between your teeth. It's hard for your body to cleanse those areas. So.
I have a big bag of Jolly Ranchers in my desk that I will be throwing out today. Well, thanks for coming in.
Thank you.
All right, up next, meteorologist Joe Hansel will have another check of your weather forecast. And if you're just joining us, your headline rewind. But first, let's send it over to NBC's